Good morning, Team Redstone. Colonel Kelsey Smith here for your next installment of the Team Redstone Virtual Town Hall. I got to be honest with you, it's a little lonely here today. I am minus my sergeant. What's that?
Still no sound.
Uh-oh.
You're on 30 seconds.
Yeah, here now.
Okay. Am I on now? Okay. So, good morning, Team Redstone. Colonel Kelsey Smith. And I am here for your next installment of the Team Redstone Virtual Town Hall. I got to be honest, it's a little lonely here today. Colonel Medor is hard at work transitioning in Colonel Bob Cardenas as the new Fox Army Health Center commander. We'll invite him to join us here in the next couple days, or for our next version. And Sergeant Major Jimenez is off in El Paso. And he is attending a graduation for his daughter, and then his daughter, his son, and his wife will all be joining him here at Redstone Arsenal. We'll have the Jimenez family here to join all of us in the Team Redstone family. I'm sure that you are all very interested in the recovery plan, most notably, likely when the gyms are going to open, when the pools are going to open, and so forth. And I'm going to tell you, I really still don't have that answer. And it's largely because of what we're seeing in the community and how COVID-19 is affecting our community. There is good news. I know that you've been watching the news, and what Alabama has experienced and what the 16 county community that makes up Team Redstone has experienced since the Memorial Day weekend is we have experienced the maturation or the incubation of the COVID-19 virus in some of our neighbors. And that has slowly and drastically raised the number of positive COVID cases within the arsenal. We peaked, or within the community, I'm sorry. And that peaked, it peaked about 4 days ago. And what we have seen is we have seen a reduction since then. We were running about 44 to 55 cases, new cases, a week prior to entering the Memorial Day weekend. And since then, we've peaked at about 90 and then up to 144 and 182. And we're slowly making our way back down to a reduced number of new cases. So good news, or bad news, is we did see an uptick in new cases within our community and within the state of Alabama. But we are beginning to see the good news is we are beginning to see that reduce. Hence, last week you heard me tell you that I was going to make a recommendation for us to continue at phase 1 of our recovery and stay the course, not add any additional a lot of new work here. And that recommendation was approved. And so to this week, we really see not much change at Redstone Arsenal, and we won't see that really any measurable change until the 22nd or 23rd when I, Colonel Medor, his replacement, Colonel Cardenas, and the other senior leaders here on the Arsenal make our next recommendation to the senior leaders about where we should proceed. If we continue on the current path, and we continue to see the viruses reduce, and we continue to see the viruses reduce within the state of Alabama, I think we may have an opportunity to say that the conditions are set for us to move to the second. But once again, it's conditions based, and so we'll continue to monitor. I'll tell you, based on new tests or new positive cases, we're seeing a positive. On our capacity to test here on the Arsenal, we retain a green, or we're in very good position for capacity to test. Fox Army Health Center, as well as the surrounding community, have the ability to execute the test and execute it quickly. When we execute it quickly, that allows us to take any single infection and get that isolated relatively quickly, test anyone associated with them in order to make sure that we're not allowing that virus to spread. Our capacity to monitor, Fox is continuing to monitor daily any of those individuals who either are positive or have come in contact with someone positive, and that has allowed us to continue to monitor, and we're very happy with that. And then our capacity to treat. Within our 16 county community, there are 360 ICU beds that are equipped with ventilators. And we see that about 55% of those beds are available each and every day. And they have a limited number of COVID patients in each of our hospitals. So our capacity to treat remains amber. And so I would tell you that we're in a position where if we continue to see the virus continue to recede, I think we'll all be in a good position. I know that the ticker continues to go up across the nation, but I would remind everybody that about 60% of the 2.1 million people that have been infected by COVID, about 60% of them no longer are. They're on the road to recovery, and they are back at work, within their communities. What I do want to stress, though, is that as we all move about our days, whether it's physically at work, telework, or administrative leave, or on our weekends and our personal time, I think it's important for those of us who have less experience, meaning we're under the age of 60. I think it's very important for us to realize that 51% of the COVID positive cases within our 16 county area, 51% are between the age of 5 and 51. And so that's important for us to understand that each of us is responsible for how we interact with one another and who we put at risk. That's why you'll see within your tenant organizations there is continued emphasis on wearing a mask anytime you're within 6 feet of one another. Wearing of a mask not only protects you from someone else's spittle or someone else's virus, but it protects others from yours. Your mask retains those potential viruses within inside your mask if you become infected. Continuing to wash our hands. Sergeant Major coined the phrase that the solution to combating COVID is in the palm of our clean, wash hands. That is the number one way that we can spread this, along with close contact. And so it is inherently each of our responsibilities to keep ourselves healthy. I'll tell you that your organizations, the Garrison, have gone to great effort to put in place precautions, to purchase PPE, to put up spit shields, to increase the space that each individual has in order to bring us physically back to work. But the truth be told, that we can put up all the precautions we want, but if our individual workforce and if each of us is not abiding by our own personally accountable actions, the virus will continue to spread. Your organizations have put the mitigation measures in place so that when they do call you back to work, I can assure you, you will be just as safe coming back onto the arsenal as you would going to a grocery store, a restaurant, or visiting a family member or friend's house. Those precautions have been put in place, and they'll be in place before we're invited back. Those are part of the conditions of being able to welcome our workforce back to the arsenal. That said, again, we remain within our recovery phase 1. We have introduced or reopened a few services. We have increased capacity at the gates, the CDCs, the school-age centers. The eateries remain open, even though they're in takeout only. And we have opened up some entertainment opportunities: Auto Skills Center, Arts and Crafts, and the golf course. And we do have business practices that we are putting in our other activities that specifically that the Garrison offers. You know, bowling, boat rentals, RV parks, and so forth. We're putting in quite a few other precautions in hopes that, and business practices in hopes that we will soon reach a condition where we can invite you back onto the arsenal for a couple of those activities, as well as invite you back here to help us continue to ensure this mission occurs at each one of our tenants. Now today, I'll tell you, I only had 2 questions that were preemptive, and so I'll attempt to answer those questions, but I will admit that I am remiss. I did not bring that piece of paper down, so I'm counting on Julie here to bring me the 2 questions, as well as I think one just hit.
No, that's going to be all next.
Okay, and so the question was, I'm PCSing soon and need to make arrangements with transportation for my household goods, and who do I call? The good news is your transportation is supported by the Logistics Readiness Center and Ed Trevino and his team over there. And I got to tell you, the LRC has done nothing but move mountains for us. Ed and his team have continued to keep the motor pool the GSA motor pool open, the CIF, and everything else have continued to operate throughout the COVID crisis, and they are open for you today. So I encourage you to get online to the Team Redstone website and go to the transportation and give that number a call. Transportation is at work and has put in place COVID precautions to ensure that when those movers come to your house, you have a quality assurance rep that observes and makes sure that private or commercial company is assisting you and is assisting to keep your things safe and healthy, whether you're here or you're arriving at your next location. Please call the LRC, the transportation office, and they'll be able to take care of that. The next topic, because I don't see any questions popping up just yet. Well, never mind, I got one coming. But I'll answer the next question, and then if we have a spot of time, I'll talk to you a little bit about a new procedure we're going to put in place at all of our gates called AIE4. And so we'll talk about that a little bit, because it is going to affect each and every one of us. Rachel, thank you. So something, we do have a PAO intern here with us. Her name's Rachel, and she's on loan from AMC. And so she's making sure that she's monitoring you on the Facebook Live and making sure I get your questions. So let's make sure we put her to work and have some questions for me to answer. Is the One Stop open for walk-ins to renew CACs? It's a good question. The answer is yes. However, if you go in a walk-in, they are going to work you between the appointments that other people already have. So I absolutely encourage you to call our One Stop, and we will book you an appointment. Call. Don't go online and use the Army level appointments system. That one is notoriously long wait times. But do give our One Stop a call, the CAC services, and it is on our Team Redstone site. And they'll book you a time, an appointment that you can count on. You should know that if you go to the One Stop, we have reduced the seating capacity considerably within the One Stop. And so if you are there as a walk-in, you don't have an appointment, it's unlikely that you'll get into the building and you'll have to wait in your vehicle or avail yourself of the commissary, the PX, or the Class 6 in the time, and then they'll call you when it's time. What is the Arsenal planning to do if the numbers in Alabama continue to rise? Well, that's a great question. I will tell you, as we have told you before, our intent is to leave is to leave precautions in place until such time, so that we say this way. The idea is to go slow to go fast. And so while you've watched the community around us get back to work, get back to play, and try to get back to what was considered normal before COVID-19, what you have witnessed from the Arsenal is you've witnessed from the Arsenal a very measured and conservative approach to returning the workforce to the Arsenal. Our goal has been to look at the conditions out there and to only take small measured steps consistent with the response in the community to get back to our mission or to our additional missions. And you can expect us to continue to go slow so that someday we may go fast. Do I foresee us restating any additional precautions installation-wide? I don't see that happening at this point. I do see us at our individual level and at individual tenants potentially putting in additional precautions, such as mandatory cloth face covering wear, or continuing to work on alternating shifts in order to minimize the exposure of individuals to one another. I expect that to continue. But I don't expect us to take a step back, even if the numbers in Alabama continue to rise. And the good news is this: the numbers are already beginning to go down. So while we did see an increase as we watched our communities begin to recover, and as we came through the Memorial Day weekend, we did see those numbers go up. But the truth is that the numbers are now in decline, and so I can only provide you the information for what we see, and it's very difficult for me to provide you that kind of an answer. I tend to try not to work off my imagination. Our leaders are best able to represent you and best able to make decisions on facts. And though we worry about the same things you worry about, we use those metrics to inform us. We look at transmission rates within the community, within the state, and within the nation to help us inform us what we might see next. And we expected a rise of the Memorial Day weekend and the following days. And we now expect to see this decline. And so we'll continue to watch to make sure that our expectations are fulfilled before we take another step. I hope that answered your question. I am PCSing from Australia, which has fewer COVID cases than Madison County. Am I still required to quarantine? I'm trying to remember the list. But I would caution you to look at the CDC website or the State Department website. If the country you are currently in is considered a Cat 2 or greater, as far as the COVID-19 is concerned, then the United States requires that upon entry, that we go into a 14-day quarantine. And I have to be honest with you, I can't confirm whether Australia is on that list, but that's the means that you would be able to look it up and determine whether or not you would have to go to quarantine. Thank you, Julie. Okay, so the question or the statement is really the numbers are not going down in Alabama. Well, it all depends on how you look at the numbers, okay? And I will agree that the numbers of cases isn't going down, and the numbers of cases is never going to go down. You'll notice that our ticker tapes that we track on TV always go up. It's the rate at which they go up each day, and the difference, the number of new cases today versus yesterday. Alabama has demonstrated 3 days of reduced new cases, and within our AOI, or our 16 county area, we've demonstrated a 4-day decline. While the numbers do seem to, new cases each day do seem to be large, the point that we are trying to make is that each day they are reduced. There are less new cases than there were yesterday. Specifically, wow, that's a great question. But the number of new cases daily is what we watch. It is impossible for us to provide you, or the Alabama Department of Public Health, or realistically the CDC, to provide you the number of cases of people whom have recovered, and that would be a much better. It would be a much better number to know, is the number of new cases, or the number of people who have recovered versus the number of new cases. But that's an almost near impossible way to calculate. The other number we look at is the number of new cases that require hospitalization. And as I spoke before, those cases continue to remain consistent, and we have consistent capacity to treat within the local community. So if you remember, a lot of the discussion you heard on TVs was that there was a concern that the medical system would be overwhelmed with too many cases to be able to treat. And while we did see that in Italy, and there is some reporting that did occur in some of the major cities within the United States, you'll notice that the medical community within our area, within Alabama, and then even a lot of the reporting from around the nation, didn't indicate that the medical systems became overrun and were unable to treat. So long as a capacity to be able to treat those who are infected exists, and treat the number of new cases that we see each day, and the capacity continues to remain the same, we should all feel heartened that should we become sick, the ability to be treated continues to exist. So while there are factors that we continue to see things go up, there are other factors that communicate that we are getting better at treating the disease, that we're getting better at preventing the disease, and that the overall risk to each of us, while probably not changing, because we can get it from anyone we meet, but the point being is that the ability to treat and the risk to our lives for each of us is continuing to go down. Next question is, when do I see face masks not needed anymore? Wow. I wish I could answer that question. You'll notice I'm not currently wearing a mask. 1, because you couldn't hear me, but 2, because there is no one within 6 feet of me. So here on the Arsenal, so long as I am able to maintain 6 feet of physical distance reliably between me and others, then I don't need to put on a mask. I, of course, wash my hands before I come into a room most of the time, and I wash my hands when I leave. And I do my best not to touch my face, which helps me to make sure that what I do touch doesn't transmit, that I don't transmit it to myself. So it really comes down to, can you maintain reliably 6 feet of space between you and others? And really only you can determine that. Oftentimes in the different buildings that I'm in here, I'll be getting on an elevator, and there'll only be one person on the elevator, and someone will decide to wait another 3 minutes, and they'll stand at the elevator as I go up, and they'll wait for the next one to go. And that person's making a great choice for themselves. Rather than to be concerned about getting into the elevator with someone who isn't wearing a mask and they don't want to put theirs on, they elect to wait. And I think that's what we all have to get in practice to do. So while I can't predict when we will all be told that it's safe not to wear a mask, what I can tell all of us is that each one of us is free to determine when it is best that we wear a mask, and we're free to determine whether or not we get close to one another. I wore a mask at home the other day just to tell my wife that, I was going to be within 6 feet of her and I was protecting her. She didn't like that very much. So, wear your mask at your own risk, but at the same time, when you get within 6 feet of one another, put your mask on and be safe. We never know if that is what will continue to keep us from catching COVID-19, but it is one of the prescriptive or preventive ways we know will work. The next question, when will Gate 3 be open? Well, I can guarantee that whoever's asking me this question lives in southeast Huntsville or south of the Tennessee River. And I know that it takes about 6 minutes to drive the distance between Gate 3 and Gate 1, because I know that because I would use Gate 3 versus Gate 1. I got to tell you that for me to save the 6 minutes for everyone would mean that I would bring in an additional 4 guards and put additional 4 guards at risk for a minimal number of traffic. I will tell you that all of our gates today, gates 9, 1, 7, and 8, all operate with a full complement of guards and are able to open every lane during the peak traffic hours. And we are not suffering any queuing issues at any of the gates unless you arrive at Gate 1 at 5:30 in the morning, when everybody gets to the gate. And as soon as it opens, I was there the other day. I was there at 5:30 and the gate opened, and I was about 30 cars back, and I was through the gate within a couple minutes. So I'll tell you, Gate 3 may open when we begin to see demand at all of the gates, and when we're unable to eliminate the queuing quickly. Now, my attention's been called to one of the questions. Great question, and I won't call out the people who asked, but it seems that we do, and yes, we do. We do have a new light as you come in Gate 9. There is a new light there that controls traffic that between the north and southbound sections of Rideout Road, and that light is for the eventual control of traffic of those turning into the secure parcel, where some of our FBI partners and PEO Missiles and Space partners will occupy the new building you see sprouting up to the east of Rideout Road. There is a sign there that does say no U-turns, especially on a red. And it seems that my officers have done a good job of enforcing the no U-turn, even on the weekends. And so the request is out there that we put no U-turns, a no U-turn sign up, but to market Monday through Friday. And I'll make you a deal. I'll have a conversation with my traffic engineers and my officers regarding the no U-turn sign there. But I will give you a little. I'll give you a little hint. Is if you go another quarter mile up the road, you can make a left, and another left, and you won't need to use that U-turn. Simply put, is that red light is there, and that no U-turn is there for your safety. Should another car be not observing the speed limit as they're northbound and catch you broadside. So I'll have a talk with my traffic engineers and my police department to see if we can make that safe. But if we can't assure the safety of the drivers as they make the U-turn or the oncoming traffic, it's probably not going to happen. But there's an easy bypass. Another quarter mile, make a left turn, and you can make that U-turn back onto the northbound lane. What is the COVID case count and plan after everyone starts returning to work? Well, I'm not sure I understand the question. I think the COVID case count you're asking for is the COVID case count on the installation. And I'll tell you, for operational security reasons, that number is that number is not releasable. I can tell you that we have far more people, probably 8 times more people recovered than we have with a current positive COVID-19 case. And then I can also tell you that most of the individuals that work on the arsenal that have COVID-19 did not contract COVID-19 while at work. In fact, most of the arsenal personnel that contract COVID-19 have been on telework for the duration. And so therefore, those arsenal employees contracted COVID-19 either while at home on telework or while out engaging in activities within the community. What's the plan after everyone starts returning to work? And I think your question really is what is the plan if someone in your workspace contracts COVID-19? What would be the response? So I will tell you, your tenant organizations, as well as the Garrison and Fox, have all put in place some very effective measures in order to assure the safety of the workforce. Should someone come up positive for COVID-19, they report to Fox Army Health Center. Fox Army Health Center conducts what's known as a contact trace. They count each individual that person came in close personal contact with, and close personal unmitigated, meaning the person they were talking to wasn't wearing a mask, or wasn't behind a spit shield, or wasn't wearing PPE. And that close contact is those people are who Fox contacts and asks them to come down for testing, or advises them to go seek testing. And likewise, they advise your chain of command that those individuals pose a risk, and your chain of command, using that information, determines whom to put on quarantine and put on administrative or weather and safety leave for the next 14 days while they observe quarantine. If you become symptomatic, Fox is prepared and monitoring you. Fox is monitoring you while you're on your quarantine. And if you become symptomatic, you'll be asked to come in to take a test so that we can confirm or deny whether you're a COVID positive patient. From the Garrison standpoint, your leadership advises us of the workspace that those individuals were in, and then the installation comes and conducts a disinfectant cleaning of that potential workspace of that individual, the workspace of the common workspaces that others might have used, as well as the workspaces for anyone who potentially came in contact. We do that using CDC-approved cleaning methods and disinfectant methods to ensure that those people that continue to work the risk is mitigated once again to the lowest possible level. So we have a contact trace that we put in place, we have testing that we put in place, and we have cleanings that we put in place. And I'll tell you that your tenant organizations, as well as the Garrison, have gotten very good at executing those procedures. Even though we've had a limited number of positive cases here on the arsenal, we practice those procedures routinely. And I am very confident that your organization has gone through the procedures and battle drilled them in their organization and is prepared to use them if need be. Is there any discussion about adding an additional lane at Martin Road Gate East, or to double up the gate guards at peak times? And I think we're talking about Gate 1. And I hate to tell you is that Gate 1, we think we're in a pretty good spot at Gate 1, that being the east gate on Martin Road. And we believe that that throughput at Martin Road is pretty much at its best. And most certainly today, I mean, Martin Road Gate 1 is pretty much a drive-through. As we invite more of the workforce back, we may see that change. And that's why we have Gate 3 down there to the south. And as we begin to see the queuing occur on Gate 1, we'll most certainly open up Gate 3. But I don't foresee us doubling up guards there. or adding a lane. You'll notice we already have a commercial lane as well as 3 additional lanes there. There are plans in the future to expand capacity or a number of lanes at Gate 7, and as that works its way through the Military Construction Authority process or the UMMCA process, we'll begin to see those in the future, probably somewhere between 24 and 25. Now, it doesn't look like I have any additional questions, and that was fortuitous, the lead-in as we talk about gates. So on June 22nd, Redstone Arsenal will welcome in the Leidos and PEO EIS workforce who are going to begin installing a new vetting procedure at all of our gates. So starting sometime mid to late July, you'll begin to see my guards at the gates with what turns out to look just like a grocery hand scanner, or one that you see out there at Lowe's or Home Depot. But they'll have a scanner at the gate, and rather than to visually inspect your ID card, the gate guards will be able to scan your card and verify that you're in our system and you work here at Redstone Arsenal, and they'll be able to verify your driving record to ensure that you are the person you say you are, and that you have valid access to Redstone Arsenal. We believe that will allow us to increase the number of guards the number of cars that each guard is able to bring through their lane by about 10 per hour, and it'll help us increase the throughput. More importantly, though, and as the person who is responsible for your safety and security while you're here on the Arsenal, what that vetting procedure allows us to do is it allows us to look at your individual record each and every day. As we scan your card is linked to the National Criminal Investigation database, and it allows us to validate that the person we're allowing onto the Arsenal today is as much of a law-abiding citizen today as they were yesterday. Additionally, we foresee us putting what's known as RFID passes in all the lanes at Gate 9, Gate 1, and Gate 7. And what that will eventually mean is that you'll be issued another card that has an RFID chip in it, and as you approach lanes or Gate 7, Gate 1, or Gate 9, that ID card with the RFID chip will be read by a scanner, and that scanner will validate that you're in the car and that you're valid to come onto the installation, and you'll move forward through a lane that doesn't cause you to stop, that allows the guard to get facial recognition of the individual coming through the gate and allow you to pass through without ever stopping. Now, does that mean it's like the Jersey Turnpike where you're going 60 miles an hour? No, it doesn't. What it does mean is you'll be moving at 5 to 8 miles an hour, but your car won't come to a stop. If you're in possession of the RFID chip, and you're in possession of the RFID chip and you successfully pass the daily background check, you'll be ushered right through at 5 to 8 miles an hour and not come to a stop. The next question, once again, that's going to we'll start to see those individuals on the installation here on the 22nd, so only 4 days from today. They'll be installing all the server packages, familiarizing our guards with the scanners, and helping us work through the policies and procedures to effectively use that to increase the throughput. When we get those RFID lanes in, we believe we'll be able to increase throughput per lane by nearly 100 cars an hour at each lane, which will allow us to significantly reduce the queuing and your transition time. But I'm going to caution everyone that that's going to take us some time. It's going to take time for you to get used to how to use the RFID lane and how to hold your card so that the guard can scan you. And it's going to take our guards some time to get familiar with those procedures. The question I do have, I got a couple of them now. You guys are hitting me good. But this one does have to do with AIE4. Will the retiree and dependent IDs be registered as well as our CAC cards for RFID? RFID is, I got to tell you, is right now how we work the RFID cards is server dependent, and so I'm not certain really how many RFID cards are going to be available at the onset or how we're going to integrate those. We're working through that plan today. I can assure you that retiree and dependent ID cards, as well as Garrison issued cards for AIE4, will be able to be scanned by the guard's handheld scanner. But who is able to obtain an RFID card we haven't really established the procedures to do that. But when we do, I will be back on Virtual Town Hall to answer your questions and walk you through those procedures. Another question that works, that comes along with that, in fact I have two. What about civilian spouses coming onto the installation? How will they be vetted since they don't have a scannable card? That's a great question. If your spouse has been sponsored to come on the installation by you, if you've taken your spouse down to the VCC and you've requested a spouse access card, and we've registered your spouse within our database, your spouse will be issued a card that can be scanned by the guard scanner and allow access, just like the spouse access cards work, or the visitor access cards work today. We'll issue a card for your individual, for your guest. They'll be issued a card, and we'll be able to scan it. And that'll work the same way for rec passes and the likes. But I don't see that being different. I can guarantee you that we're not going to issue RFID cards to those visitors. Those visitors will pass through the gate just like anyone else, and instead of being picked up by the RFID, they will be hand scanned by the guard at the gate. How's it going to work with visitor badges and contractor badges? Once again, as we get this new system online, your current visitor badges and your current contractor badges, you'll be asked to come down to the VCC and replace those badges with an AIE4 scannable badge. It'll require the same paperwork. We'll enter you into the same database, and we'll issue the new card, and that new card will be scannable by the guards. But for most intents and purposes, you're not going to notice much difference. You're going to know that each of the individuals around you, their record is being scanned each and every day, which only increases our security. That each face on each card matches the person who's in the card, and that we are overall improving the security here at the Arsenal, but at the same time increasing the throughput at each lane. And I think that's good news for all of us. I am able to produce a safer and more secure environment, and you are able to transition on and off or gain installation access at an accelerated speed. So I think we're all going to work. It'll work out great, but I think it's going to take us until September, probably, to work through the kinks, both you as the driver and me as the and us as the operators of Redstone, and making sure that we're doing it smartly. The next question, and Rachel's coming with more, will the next one that is, in fact I got two, how will this work with the old style badges that have not yet expired? Well, I got to tell you that if you arrive at under the new system and you arrive at the gate with a badge that has yet expired, there will be a grace period for you to use that badge. But at some point in time, you are going to be required to go back to the VCC and get issued the new badge that works with the new system. What that grace period looks like, I don't yet know. We'll probably set an initial, probably 60 days from the date we start scanning would be what I think will require you, give you 60 days to go get a new AIE4 badge in order to interface with our system. Something else to know, it's good to know, is for those spouses and other folks out there who are thinking about getting a sponsored ID card, I'll tell you that the Alabama Star ID card will be able to interface with our AIE4 system. So if you have a Star ID card, you can come in and register for access to Redstone Arsenal, and we won't have to issue another badge. We'll put your license in our database, and that Star driver's license will allow you to get on the installation following that, and you won't have to have 2 or 3 extra cards in your purse or in your wallet. Question I have here is, what is the timeline for scanners and RFID lanes? Once again, we expect the installation for the scanners and servers to begin on the 22nd of June. We expect that capability, that equipment, and those scanners to be online by mid to late July, and our guards and workforce to be trained in how to employ them by then, at which time we will start to begin issuing you the new badges and begin working. We expect to be using AIE4 in a limited fashion by the end of July, and we'll be working through the kinks. All of us will be working through the kinks together in August. How will this work with scheduled events for guests to gain access, promotions and retirements? Once again, those who have Star cards will be able to use their Alabama Star driver's licenses, and we'll be able to register those with the database, or we will be working much the same as we do today, as you'll apply for a visitor access badge, and that visitor access badge or that visitor access will allow you to gain entry through the guards. We are not going to transition away from having guards at the gate, and so we will be able to accommodate those guests in much the same manner as we've always done. But once again, we're working through those procedures to be able to answer your questions specifically in the future. But today we are currently working through that. But I appreciate all the great questions. I'll take these and make sure that we're fighting through the specifics of each of these procedures. So I think I don't have any more questions for AIE4. We all know that it is coming. We're going to begin to see the work being done on the 22nd of July. The team arrives. We should have it in place by mid to late July, and we should be beginning to use the RFID system, or the AIE4 system, by late July, early August. We will get the procedures and the specifics out to each of you as we familiarize ourselves with the new system. So I'm going to go ahead and move on to the next topic. And the next topic is, can we talk about the child care facilities? Yes, I can. I'm very proud to talk about the child care facilities. So today, the Goss Road Child Development Center remains closed. The Goss Road School Age Center for those elementary school or toddler through elementary school is open, and the Mills Road CDC remains open. The Mills Road CDC has a capacity of about 135 children, and today we operate at about 55 children on the installation that we're providing world-class child care for. I just was down there yesterday, and I will be going on a visit there again tomorrow. But we are providing excellent child care there at the Child Development Center on Mills Road. And if you were a Goss Road patron, then we have asked you to bring your child to the Mills Road and allow us to consolidate our workforce into one location. And when we grow to a capacity When the demand requires us to, the demand is such that we can no longer fit everybody in the Mills Road CDC, then we are prepared to open the Goss Road CDC. At the school age services is a capacity of 145 children, and currently we're operating just under 20 each day. So capacity exists, though we don't have the demand. Our current position at each of the Child Development Center and the school age services is we are happy to see the children of patrons who have to physically be at work each day. We're not accepting telework. We're not accepting the children of teleworkers because today we are on situational telework, and so long as we remain on situational telework, we won't be accepting those kids because we've got to ensure that we have room for the children whose parents have to physically be at work. And I know that that is an inconvenience for some, and I apologize, but once again, our task is to ensure that we have room in our child care facilities to care for those children whose parents have to physically be on the arsenal. But we're about 50%, less than 50% capacity. And if you've got a child at home and you're coming physically to work each day, I ask you to contact MWR and get registered. We'd be happy to provide you our services. I think I got all those questions. Let's see what we got today. Do we have anything else? So the question, I did see one on there for AIE. Are all the cards that we're talking about for AIE 4, are they replicating our current CAC cards? If you have a CAC card, your CAC card is all you will need for AIE 4. Your CAC card, when you pass through the scanner, that first time it scans, it'll add you to our database, it'll check your record, and your CAC card is your one-stop shop, specifically for all the gates. If you wish to use the RFID lane, the easy pass or fast access lane, you're going to have to get an RFID card because your CAC card cannot be picked up by RFID. So we'll issue an RFID card to those users we wish to use the fast pass access, and you'll have, unfortunately, you'll have a CAC card and an RFID card. But those two cards go hand in hand. And so for those of us with CAC or FBI or NASA cards, those cards will be replicatable. Let's see if we got anything else on there. Well, I got to tell you, it looks like I don't have questions, and the good news is I still have 6 minutes before we expire for the day. And I got to tell you, I absolutely appreciate all the questions we got today. We've been doing these for something like 9 weeks now, and I absolutely appreciate all the questions everybody has. I absolutely appreciate the work that each of you are doing. Certainly those that are off on the side and helping me to answer questions. And I certainly appreciate the patience and kindness and support that each of you are demonstrating as we all combat COVID-19 in our own way. And we continue to execute the missions that are nationally required here at Redstone Arsenal. I'd like to make it a point that we have put a lot of precautions in place here. And the precautions in place that Arsenal's put in and that your tenants have put in are all dedicated to continuing to provide you a safe, secure, and healthy place to come to work. But once again, all those precautions can be put in place and still not be helpful if we as individuals don't do our part. It's easy to ask others what they're going to do and how other people are going to guarantee our safety and our security and our health. But the truth is that our ability to combat COVID-19 lies within the palms of our own clean, washed hands. And I ask each of us to exercise that. Thank you all for the time you've given us today. I look forward to meeting with you again. I apologize for bringing up AIE4 and not having all the answers to your questions, but I do want you to know it's new to me too. So we're developing the procedures, we're getting the equipment in place, and the point is to be able to provide you a more secure working environment and increase the throughput of the gates so we all take a little less time getting to work. Thank you all very much. Have a great day.